Hi, Grace.
Hi, Dr. Basha.
There's the two of us today. So I probably would like to know where are you working? What are you working as? And what's your academic background?
Currently, I'm practicing as a speech language therapist in Grace House Speech Therapy and Writing Center. So, my background is I graduated as from the speech therapy, speech pathology in University Science Malaysia, Kubang Korean, Malaysia, and also just completed the master in business administration. So yeah, it's a tough years.
And you did
And
it. Well
then
done.
yeah, thank you to the professors who have taught us. And then currently I'm pursuing the DBA as well. So
DBA is doctorate in
business,
business.
yeah, business administration as well. So another 5 years to go. So yeah, that is basically my few words about the
R-
background.
Right. Wow. Okay.
How about you, Dr. Basha? Where do you work? And also, would you mind to share with us about your academic background?
I work with Eartistic Hearing and Balance Center. The branch of Eartistic that I'm attached to is TTDI Branch, but I have been working online full time. So my patients are not necessarily from Lembah Kelang area. You know, they come from all over. And my training background, I graduated from UKM with speech sciences, bachelor in speech sciences, which made me a speech therapist. But I was from the third cohort, the first three.
Oh,
The third cohort of UKM when it just started speech therapy. Dan
wow.
selepas tu saya pergi sambung belajar di Melbourne dalam
Oh,
bidang pengajian masalah pendengaran, deaf studies.
mm,
So I have a PhD in deaf studies, and because of that kind of training, I only see cases with hearing loss, sama ada dari baby ataupun peringkat warga tua yang perlu untuk bantuan dalam memperbaiki ataupun untuk memperolehi bahasa lisan.
okay. So, Dr. Basha specialist is more on the dealing with the hearing impairment population.
Yes. What
from
about you, Grace?
Pediatric.
Yeah.
I do cover all ages from pediatric to adult.
Okay.
But currently, my current practice predominantly will be pediatric.
And you see all the other cases as well, right?
Yeah, speech and language, feeding, soloing. Yeah.
Okay. Well, I actually have questions coming from parents that I think we can help them with this. All right. I think we can see on the slide now. I think Grace, you can see the slide. All right. Soalannya adalah parents ni, mak bapak ni nak tahu macam mana dia nak tahu yang anaknya dari segi pertuturan dan bahasa adalah normal. How do they know that their child's on track?
For the parents who ask this question, actually the main way is to find a speech language therapist, cari therapist pertuturan bahasa yang certified. Lepas tu buat evaluation, penilaian. Lepas tu baru tahu dia normal ke atau tidak untuk dari segi speech and language. So first of all, do the assessment. Usually what we have done in the assessment is to try to get the interaction with the child, to observe how is the communication and then get the baseline so that we know how is the direction for the therapy go. So basically some parents can also get the referral from the pediatrics or from the GP in the in the medical field, and then to check how is the developmental like the development for the speech and language, and then get some hint to get some red flags, and then still go back to the speech and language therapies. So after that, they will know whether the child needs the therapist or not. Because sometimes when I think in the speech and language field, I found quite challenging is parents readiness. It's not the awareness. Actually, they are aware something is wrong, something is not quite sure, and it's quite uncertain when they compare with other same age peers. So the readiness to accept their child has something quite different, to see, to take the first step to see the speech therapist is quite different, quite challenging.
Dan nak commit to therapy, isn't it?
Yeah, the commitment. So I think from parents can see the assessment as an investment to make sure, to ensure that their child rule out any diagnosis or to confirm any diagnosis of speech and language delay. So if still better, you can get the initial assessment report from the speech therapist, so that can work collaborative with other disciplines as well to help the child in a better way. Yeah. So yeah, that is my 2 cents regarding this question. Wish it helps.
Yeah. I suppose you also have a question from parents.
Yeah. Dr. Basha, these parents ask, dia dah ready dah, dia nak start terapi, tapi dia ada call up banyak speech therapist, and then banyak yang offer online je, which is the therapy online, the telepractice, basically due to the SCMCO. So they ask whether it's effective or not. So would Dr. Basha share a bit more about the telepractice? Because you are senior and very, very experienced in this field. So
whenever you say senior kan, I dapat rasa my kedut-kedut banyak.
Knowledge, very knowledgeable.
I hope so. Okay. Now the pressure is on ya, nak jawab ni sebagai seorang senior. Well, the thing is, if parents assume that teletherapy macam kelas online yang lain untuk anak-anak, then I rasa memang dia akan ragu-ragu. Sebab macam mana nak suruh budak 3-4 tahun, even kadang-kadang 6 tahun pun ya, duduk depan screen, duduk 1 jam and interact with therapist. If that is what you think teletherapy is, then memang tak work lah, memang tak efektif. I pun tahu tak efektif. But let's go back to the very basics of therapy from a family-centered point of view. I'm a family-centered therapist, meaning that I see the family, especially the parent and the child, and this interaction as the main thing in the intervention, not just the child. So when I look at that as the main thing in the interaction, so parent has to play a very, very critical, crucial role. In fact, kalau parent tak ada dalam terapi, I tak boleh buat. And this is applicable whether dorang untuk teletherapy ataupun kalau dorang datang jumpa in person. Parents have to be in here. Parents have to be my main role. You kena play teraju utama. Kalau filem P. Ramlee kan, dia kata teraju utama. Okay, itu peranan parents. Because if your child only interacts well with the therapist, but not with the parent, you wonder what happened outside that 1 hour per week. Yang anak tu tak interact dengan therapist. So, for teletherapy to be effective, it really has to have the parent as the main person. Yang saya akan cakap, okay, now you say this, all right, stop that for a bit, you change your voice a bit, or you say it a bit slower. Kalau nampak parents dah makin macam hot ya dengan anak dia, I can see they are getting a bit angry. Sekejap. Okay, you pergi minum air sekejap, you suruh anak minum air sekejap. Because these are the very, very real problems that parents have when they deal with their child at home. And I can see that and can help them while it is happening. Right? So, itu beza dia. Sebab dalam terapi, kalau terapi itu sebuah kereta, parent is the driver, I am the navigator. I bukan driver. Driver parent ni minta maaf, jangan suruh saya jadi supir. I'm not the driver. I just hold the map and I help the parents through collaboration and negotiation how to get to the place that we want to get to, our destination. So yeah, that's my 2 cents as well.
I do agree with Dr. Basha that and I really like the idea that you can offer the solution on the spot. Like calm down the parents when they are feeling angry. So
Yeah.
with the misbehavior.
Yeah.
So yeah. So really see it as a holistic approach through the telepractice. Okay.
Okay, now talking about
Mm.
holistic, right? And before CMCO, the whole face
Yeah.
of
Yeah.
ours boleh nampak, right? Bila patient
Yeah.
datang. Now
Yeah.
our
Yeah.
whole face is no longer whole. So macam mana, Grace? How do you feel? Apa bezanya now bila patient datang ke session kan?
Mm-mm.
And half your
Mm-mm.
face is covered by mask.
To be frank, initially I felt quite hopeless and helpless because I need to put on the mask and then I can't show them the visual cue. I can't for example some child they can't pronounce the b sound and then I need to show them the lip movement and then there is no way to show them. My lip is behind the mask, so I think this condition trained me to be much more creative and flexible so that I need to before the session, I need to record down the lip movement, like saying "buh buh buh," and then I just play the video during the session. So, beza dia, I think the implication, I mean, the impact is quite big. Just the way that I need to achieve the goal, I need to do some modification. I kena lebih flexible sikit lah as a clinician. So, yeah, yang tu lagi saya kena encourage parental involvement. For example, due to the physical distancing, I can't really touch the child, but I need to provide the physical prompt. So at their home, their parents has to offer such cue to the child in order to achieve the goal.
So again,
So
parents kena tahu macam mana nak bagi cue,
yeah,
macam mana nak buat the exercise and all that, isn't it?
yeah. So I think the facial mask give me a sort of like reflection on my clinical approach, so that I'm trained, I'm forced to discuss all those the inconvenience to them, and then they need to do such activity at home, and then if it doesn't really work, and then we need to brainstorm about the alternative strategy so to help the child. So I think it's good to have this condition so that I'm aware of the implication, and then I'm forced to be train them in a better way. I would say like holistic approach that Dr. Basha say.
Right.
Yeah.
Okay, now I think this is your question.
Yeah, that's my question as a junior to Dr. Basha.
Junior yang tak ada kedut-kedut
So Dr. Basha, would you mind to because you have been experienced in providing the online speech therapy, and then would you mind to share a bit more tips for us how to make it much more effective? Because sometimes I don't really know the way to maximize the effectiveness of the online speech therapy. So would you mind to share with us a bit?
Okay, I think the first tip I dah bagi masa your previous question tadi about
Yep.
Parents playing the major role. And the second tip is that it has to do with what is the universal thing that all children all around the world will do. All children will mandi, makan, pakai baju. Tak kisahlah baju apa pun dia pakai, right? Akan bermain, tak kisah permainan dia toys ke tidak. So these are the things that they will do regardless they live dekat kutub utara ke, dekat kutub selatan. Ada ke orang duduk kat kutub selatan? Tak ada. Duduk kat Canada ke, duduk kat Malaysia ke. They will all do this. They play, they eat, they bath, they wear clothes.
Yeah,
so,
the basic needs.
The basic needs, you know. Yeah. And now it's COVID-19. All kids akan learn to wash hands. Yeah. So we need to think how to use all these common activities yang budak buat tiap-tiap hari and use that as our speech and language tasks for different aims. I just bagi example, contohnya wash hands tadi kan, wash hands. How I have used wash hands antaranya is for singing. Ada satu lagu Baby Shark tu ditukar jadi wash your hands, wash your hands kan. So dia boleh jadi singing. wash your hands juga menjadi vocab punya exercise because you ajar turn the tap on, buka pipe, oh lajunya air, oh dah basah, tadi kering sekarang basah, masa keringkan tangan, tengok tangan dah kering, kesat, tangan dah kering. So all this vocab. And apart from that, the sound, shh, air keluar, bubble, bila sabun kan ada bubble, bubble. Those speech sounds. And you talk about sequence. Mula-mula buat apa? Apa yang bagi kita ada buih-buih dekat tangan? Kita letak apa? That's a bit of cause and effect. And for an older children, we can talk about apa beza kalau basuh tangan dengan tak basuh tangan lepas kita pegang benda kotor? Apa beza dia? Apa akibat dia? We talk about that if the child is ready for that sort of conversation. That is just from washing your hands. So to me, teletherapy is so great because I can go to their house without actually going to their house, if you know what I mean. I've had therapy sessions done in the kitchen, in the living room, in the child's bedroom, depan almari baju, dalam bilik air sebab basuh tangan, bawah meja sebab dia main sorok-sorok, you know, anything. You just have, like you said, wearing mask forces you to be creative. Teletherapy has forced me to be creative. Just for the record, I've started doing teletherapy even before COVID-19. And when I started, I was rigid as well. I think the first 10 months probably, I was still quite rigid. But after that, you start to get the hang of it. The more you do it, the more you get the hang of it. And there are things that you try and error, you know, but if it works, then you keep improving on it.
But I do love that the hand washing activity, that hand washing is not just wash the hand, but Dr. Basha can see beyond the activity and actually elaborate and zoom in into each step and teach different language go. That is really, really eye-opening for me.
The parents sometimes complain that all the child wants to do now is to hand wash. So not my fault, I hope.
Oh, okay.
So those are our 4 questions for today. Grace, kejap je kan habis 4 soalan.
Yeah. Thank you so much for Dr. Basha for your sharing today.
Oh, thank you for spending these 4 questions with me, and I hope we can do this again. And good luck with your DBA.
Thank you so much. But I think telepractice is really interesting topic that we actually like deal with it in this reality.
Yeah.
In current situation. So.
And there's much more that we can explore, right? Yeah.
So, yeah.
So I hope that whatever that we share here can help the parents out there, mana yang rasa nak jumpa start bertanya pada speech therapist tapi belum lagi, tak berani lagi, please do start. Macam I suppose Grace ada juga parents yang dah mula bertanya kan pasal terapi, dah mula start call kita, but they themselves tak mulakan lagi, right?
Yeah, belum start lagi.
Yeah, what do you have to say about that?
I think I can ask them to actually spend an equal amount of time on the pros and cons, and if possible, try to see how to teach the child in the safest way through the telepractice. I think telepractice is a quite good solution in this pandemic situation, and most probably will be the parental involvement is very, very important. Like they can do the capacity planning, like the daddy holding the camera, mommy do the implementation, do the activity, and child respond to them, and while we are the map.
Yeah. We navigate with them, but they drive. Isn't it?
Yeah.
One
I think
thing
that would be great.
Yeah, because what I've never heard of any parents in the past 20 years that I've worked is that dorang tak pernah cakap, nasib baik saya tunggu. Nasib baik saya lambat jumpa. Saya tunggu dulu tak jumpa speech therapist. I've never heard that. So just put a stop to the waiting.
I do have a parent say that I should start earlier. I should not wait.
Many of them said that they
It's
should have started
It's very
earlier.
sad actually, because we can't buy the time.
Yeah, you cannot. Whatever that is past is past.
Mm, mm, mm.
So, well, thank you again, and I hope to see you again.
Okay, sure. Thank you, Dr. Basha. Thank you so much. I do hope I have the chance to learn from you again.
Thanks to you. We learn from each other. I learned from you too today, Grace. Bye.
Thank you so much, Dr. Basha. Thank you.